You always have the latest. It's cutting edge what you guys have at the Simulation Center.
It is.
We got a chance to tour the Sim Center last fall, was it? For the Starry Night thing?
Mm-hmm.
So we got to see firsthand everything that you're doing. So I guess what is the Simulation Center? What do you do there?
Yeah, so the Simulation Center, we take and apply simulation to all of the nursing and applied health programs. So that way students are able to take what they're learning in the classroom and step into a realistic scenario or environment to practice the skills that they're learning.
That's a real patient who just got a elbow implant.
She had a hard time that day.
Okay.
Yeah, poor thing. She's okay now though.
Are they more than just like plastic? Can they do more
They
than?
can do so much. They can be intubated, you can do CPR on them, you can put IVs in them, they can have wounds as you see, they can have seizures, you can talk for them.
They cry. I was there.
They do cry, yes. Yes, we can turn that off though, luckily.
They can scream bloody murder
Yeah,
when you strike a nerve.
I may have done that to you on purpose.
So Anthony, you're the medical advisor for the Sim Center. How realistic, what are you seeing that is benefiting health career students?
Yeah, it's pretty crazy how technology has advanced to the point where we can recreate pretty lifelike scenarios for students to learn from without needing to interact directly to live patients firsthand. So now with all this new technology that we're sort of getting shipped, within next week to open this center, they're going to be able to practice with all this new technology and sort of be able to be more confident working with real life patients when they graduate.
So what's your role? How are you involved with the Sim Center?
Yeah, so really my role is to help provide some guidance on creating the scenarios that we might have for the students. So we'll sort of go over different types of scenarios of how they come in, what they might say during the script, medically what might be wrong with them, how should they treat them, and then also try to create some of the curriculum as well for the students whenever they go through the program.
Well, that's a lot to handle as an instructor because
Yes.
every day something new might come in a box,
Yeah,
right?
absolutely, and that's why he's so important.
One of the cool things you have the what are those called? The goggles.
The headsets
Yeah.
for the virtual reality, yes. And we're getting a program to where we can go and take pictures with him at Henry Ford and create the entire look. So students can put on those VR headsets and be in Henry Ford OR or ER, and everything is the same. So we can enhance that comfort for them. So when they go into real life practice, they've already been there before. So it's a great tool for them.
And it's something else besides the VR headset. You have this table that is like 3D.
Yes.
It can be a human body.
The anatomage table. It's
Yeah.
a electronic or table cadaver. So you can see all of the body systems, pull them out. You can watch a piece of food travel down the entire GI tract. You can do a heart cath on there. It's a lot of really fascinating things that really connects it for students, outside of a textbook.
So what are the health careers that students are in the Sim Center?
Mm-hmm.
What are they studying to be in terms of their next step?
So we have nursing, and then we have EMS students, medical assistants, respiratory therapists, sonography, all 3 programs for sonography, radiology, dental hygiene.
Really?
Yeah.
Wow.
Yep.
Everything.
Everything.
Everything you guys do.
It's wonderful. Yes.
Do you see the education you got when you were in school a lot different with this kind of, I guess, technology and AI?
Yeah, I think it's really nice to have because back in the day, not too back in the day, but back in the day, we didn't have, all of this advanced technology to sort of recreate things that almost seem, lifelike for you. And so now they can sort of practice as many times as they want because it's a pretty accessible center for all the students there. And they can just keep practicing and practicing until they sort of can perfect whatever procedure or simulation they want to work on.
Awesome. I did want to mention Dr. Tam is also an advisor and team physician for USA Wrestling, cycling, and Special Olympics. You do a lot outside family practice.
I do. Yeah.
When do you have time for all that?
I seem to be able to create more hours in the day sometimes, thankfully.
Well, that's got to be a great experience because I know part of your family practice has to do with, orthopedics and physical education and sports medicine.
Mm-hmm.
Yeah.
What did you do? What do you do with cycling and wrestling?
Yeah, so it all started a few years ago when I did a rotation with Team USA out in Colorado Springs. So I worked out in the clinic and provided care for any of the resident athletes or visiting athletes there for a month. And then after that, a few of the Team USA teams were reached out and wanted some help with coverage. So with USA Wrestling, each year I usually do an international trip. So I travel with the team and I'm usually the physician for anything that happens for Team USA. It's usually like a week-long trip. For wrestling, it can be sort of weird locations. So this past year in February, I was in Albania, which you wouldn't think would be, a spot that you would ever really travel to. But it was very fun and great to hang out with the people that came along with me. And then with cycling, I usually host and am the physician for the track national championships for the Madison, which is like a sort of a partner race. And it's usually held in Detroit, so locally and here in Michigan. So, yeah.
Awesome. Well, that's a great experience you offer your patients, but also the students you're working with. And Sarah, you've got a lot of clinical experience as well. You too are first physician assistant.
Yeah.
First aid and CPR instructor. So having providers be part of the faculty, that's got to be a great bonus for students.
It does, and just teaching, again, showing these students real life experience, because you can read a textbook all day, but hearing personal stories from what we've been through, or there's always that patient that sticks out that changes your whole career. Sharing that and that life experience, I think, goes a lot further.
Yeah, I can see the students saying, well, I want to be that. I want to do that too.
Yes.
You've got another Healthwise event coming up.
We do.
And when is this?
This is September 18th. It's Thursday from 10 a.m. to 1 p.m. And it's free for everybody to come. There are some of the screenings that do require a little ahead of notice, so they can just call the phone number to schedule an appointment. But it's going to be a large event that we're going to continue to have every year.
And people can sign up for various screenings.
Yes.
Any particular area that you guys are concentrating on this time?
So the biggest ones that need an appointment are the oral cancer screening with the dental clinic, and then the vascular screening, and then the blood drive that we're hosting.
Cool.
Everything else is just walk in and have it done.
Staying on top of technology, well, that's happening right now. You guys are renovating.
We're done
Oh, you're
renovating.
done?
We're moving in now. Yes, the
Just
ribbon cutting is October 13th, and we're going to be ready for the next Starry Nights for you to come visit.
Nice. What did you do? What kinds of improvements and renovations?
That entire center has been completely redone. It now looks like when you walk into the center, it looks like you are walking into Henry Ford. And we very particularly picked out the colors to match Henry Ford, again, so our students feel comfortable going from there into practice, because just having an environment that looks the same minimizes your anxiety for situations.
Yeah, I kind of felt like half of the sim lab did look like a clinical setting, but the other half looked like a pretty plain classroomish kind of box.
And now it looks like a completely different area.
And everyone will be invited to come check that out when it's during the grand opening.
During the grand opening, yep.
Awesome. Well, it's been great to have you both with us
Thank
today.
you.
Yeah, thanks for having
Thank
us.
you for having us as always.
Yeah, lots of great health education happening at Jackson College. From JC and the Sim Center,
Thank you.
Sarah Case, simulation instructor and medical advisor, Dr. Anthony Tam. Up next on